How to take case history for a patient with fever. Taking a fever history is unlike any other, as it does not focus on a particular body system. Aspects of the personal, general, and specific histories of all other systems need to be explored. Chief complaint. Patients may present with fever as chief complaint or fever, along with an array of other symptoms that may be of concern to the patient. Example: fever since 3 days and a cough since 2 days. In such cases, record fever as the chief complaint and document the rest in associated symptoms. History of presenting illness. Start with open-ended questions, then ask direct questions to elicit the finer distinguishing characteristics of the fever. Ask about, since when the patient had fever. Example: fever since 2 days. Onset of fever, that may be sudden or gradual, the former more likely to represent a more virulent disease, while the latter suggests a more indolent one. Note whether the fever is of acute, subacute, or chronic duration. Document the progression of fever in terms of grade, severity, frequency, and associated symptoms. Grades of fever include low, moderate, and high. Hyperpyrexia is a condition where the body temperature goes above 106.7 degrees Fahrenheit. The pattern of fever should be described as continuous, intermittent, or recurrent. Ask whether the fever is worse in the morning or at night. A description of the fever should include the presence or absence of rigors, which usually indicates a rapidly rising temperature found in malaria or severe bacterial sepsis. Ask the patient about factors that aggravate or relieve fever. Remember that the taking of antipyretics, anti-inflammatories, or antibiotics can mask a fever, so ask the patient if he has taken any medication. Past history of certain diseases. Infections are more frequent and more serious in patients with diabetes. A past history of rheumatic heart disease increases the risk for infective endocarditis. Previous tuberculosis assumes a risk of recurrence. Immune compromise increases the risk, severity, and scope of infections. Ask about underlying diseases, such as HIV, medications such as steroids or chemotherapy, or a history of a splenectomy. Recent hospitalization and surgical history. Recent hospitalization is associated with hospital-acquired multi-resistant pathogens. Surgery, invasive procedures, medical devices, implants, and transfusions all provide means for introduction of infectious agents. Antibiotic usage. Antibiotic use may select for more resistant pathogens and increase the risk of antibiotic-associated diarrhea. Antibiotics may also provide protection against infection in certain groups of immunocompromised patients. Family history. A family history of non-infectious inflammatory diseases can indicate a genetic predisposition that may increase the risk of developing a non-infectious inflammatory disease. These may include connective tissue diseases, vasculitides, and granulomatous disorders. History of behaviors and exposures are important in infectious diseases. Obtain information regarding the following: contact with anyone having similar symptoms or living with someone who has been treated for an infection. Living arrangements including access to clean water and sanitation, proximity to animals or rodents. Food habits including ingestion of unpasteurized milk or cheese. Occupation, hobbies, and sports, especially those involving exposure to water, animals, or healthcare. Check for a history of insect or animal bite or scratches. A history of exposure to radiation or toxins may increase the risk of certain malignancies. Recreational habits, especially illicit drug use or tattoos. Unprotected sexual practices increase the risk of both sexually transmitted diseases and bloodborne viruses. Travel and vaccination. Details of travel include whether the stay was in an urban or rural setting, stay was with family or friends, in a hotel or without facilities. Also inquire whether the patient had appropriate prophylaxis, including vaccinations, either when traveling or at home. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.